welcome to our Monday Minute. Today I want to share with you an update to the ICD-10 coding codes that will go into effect April 1st of 2023. Typically the largest update that is going to occur with ICD-10 codes happens in October of each year, and there were multiple changes this past October. But there are also changes that can happen, and typically there are at least some tweaks that occur and go into effect April 1st of each year. This year, there are going to be over 40 diagnosis codes that are added to the ICD-10 code set, many of them specific to social determinants of health. Social determinants of health have really been a huge part of the CMS push recently to get more input on social determinants of health and assist in risk adjustment and other items that might impact outcomes, et cetera, of healthcare entities. In going forward with that approach, they have added to the mix several diagnosis codes that will be available again effective April 1st to be utilized in your coding. Do be cautious in the fact that there are 25 diagnoses that are available to be reported on your claims. And obviously, if there is a push for 30 diagnoses on your patients and only 25 are going to be on claims, you need to ensure that the order of the diagnosis is such that any that would impact reimbursement are going to be in the top 25 and be reflected on your claims. I understand that for many patients, probably most patients, 25 diagnoses are not a consideration, meaning that volume of diagnosis is not typically going to exist. But on the ones that it would exist, if the code is not on the claim, it cannot impact reimbursement, and only 25 will fit on the claim. You also need to ensure that your staff become familiar, especially your coding staff, with the ICD-10 codes that are being added to go into effect April 1st, so that they are familiar with those codes as the diagnosis themselves might be written as far as titles, et cetera, are concerned, from your field staff, from your physicians or referral sources, and that they will understand what those mean and make sure that they are coded appropriately. Some of the categories may already have existed, and they have simply expanded those with additional digits. It is always vitally important that for ICD-10 coding, you code all diagnoses to the greatest specificity possible, ensuring at all points in time that any diagnoses that are coded on your patient chart originated with an allowed practitioner that is allowed to diagnose patients. That, of course, is not your nurses. We hope that this information has been helpful today. We will provide a link to the ICD-10 coding update for April 1st in this minute. And if there is ever anything that HPS can do for you, including assistance with your coding, feel free to contact us at any time. We will be happy to help. Have a fabulous week.